I could not find my brother. Then they said he passed away yesterday. No, I lost my brother to something called hospital operational negligence. So I thought, can I use AI to fix this operational inefficiencies in healthcare? So that's how the journey started.
Hi, everyone. My name is Carmen Durvat, and I will be hosting today's episode of Behind the Founders. And today I will be sitting down and interviewing Sal. Sal, welcome. Can you introduce yourself?
Thank you very much for this awesome podcast, Carmen. So about me, I would say almost 20 years in the field of martech and AI, and currently I lead a startup called RxGPT Health. It's a healthcare AI startup which aims to solve the kind of problems we face at the hospitals, healthcare units, and also at the clinics. And I've been leading the startup from last 2 years. 2024, we started this basic groundwork of the startup and all, and the actual work started in 2025, and almost 2 years, and I'm kind of running this as a CEO and founder along with my co-founder. Right. So that's all about me. Before working for this startup, I worked for many companies. Like I worked for Cargill. I was at Cargill handling an entire Asia Pacific division of Cargill's digital and social. All this I was handling that. Before that, I was with many companies in Silicon Valley, in New York, marketing agencies, startups in California, in Florida, Miami, right? All these startups. I was the first employee to join there because I love building things from scratch, right? I mean, there was no one in my marketing team or AI team. I was the first one, first hired, and I built the thing from scratch. Before that, I was with GE Healthcare, leading the entire GE's product marketing in Australia and New Zealand. So likewise, I love challenges, right? So that's why that kind of brought me to build this thing, RxGPT. Apart from all these things, I'm also consultant to many startups as a fractional CMO, many of the startups, because I love also helping other startup founders grow, right? So whenever it's possible, I consult them, advise them on how to set up their startup, how to do venture funding, how to do GTM, how to establish those agentic AI workflows, everything at your startup. I've been consulting them from last so many years. And I'm also a consultant to many, I would say tier one consulting firms. So when they need any my support, they kind of seek my support. I've also sit at advisory board at many companies, including Pinterest, and I'm part of the Pinterest advisor. So likewise, so this is all about me and my career and my journey so far.
Yeah, I can see that you definitely have a lot of passion for creating things, building things from scratch. And I see that, you, as you mentioned, you've built and you've been founding RxGPT, as well as I see on your LinkedIn that this year you also co-founded or started Hire X AI as well. So you
Yeah,
do have a couple
yeah.
of those businesses running. Could you, first of all, share with the listeners out there what inspired you to start going into the more founding-oriented direction?
So I'll say most of the founders, when they start, journey starts with a logical, with a, no, I would say mostly with the aim to change the world and everything. My journey was personal. I'll tell you what happened in 2021, on 22, I would say. Around that time, COVID was peaking and it was at the highest peak. And me and my wife and my brother, we three were affected by COVID, right? And we were admitted to a hospital, and there are a lot of chaos at the hospital, right, because of COVID. But still, no, nothing was streamlined, nothing was proper at that time. So what happened that one day we all on the same, I think, same level. And the next morning when I woke up, I could not find my brother, and I asked the hospital authorities like what happened to him. Then they said he passed away yesterday. So now why he passed away? Because he could not get those kind of, I would say, all this kind of facilities, all this kind of thing on time, right? So that kind of motivated me that I lost my brother to something called hospital operational negligence. Like all these things were not available. He didn't have the proper lab reports. He didn't have the proper all these things, right? So he passed away, and somehow we survived because of maybe our I think was not that serious, but he was on a serious note, but he passed away. So that kind of motivated me that I've been working at corporate like Cargill. I've been working at many other companies. to solve this AI problems, marketing problems at the highest level? Can I go down and use my skills to solve problems at the ground level, fixing the healthcare? Right, healthcare is a is something that is essential to everyone, but no one, but everyone takes it like a granted, right? When you go to any hospital, go to anywhere, everything is kind of chaos. Nothing is structured. So that's nothing. It was not even. I didn't never thought of making $1 billion company or making or starting something that would change the world. Started from a personal, personal call, and now it has become my purpose to help healthcare hospitals streamline and reduce their operational inefficiency.
Wow. First of all, Sal, thank you so much for sharing this personal element of the story as well. And I first of all want to acknowledge, like, I'm really so sorry for the loss of your brother. I know that it must have been such a tough time, especially with a lot of changes going on. And it's really commendable that you were able to take that tragedy and transform it into solving the problem so that it does not happen in the future when it comes to patient negligence or the missing the data and everything like that. So, having said that, I would love to learn a little bit more about if you can explain to the listeners out there who have never came across RxGPT, what is the purpose of RxGPT? What is it for?
Sure, sure. Let me just make it very simple, like in explaining to a fifth grader, right? So let's say you walk into a hospital, any hospital, maybe in the US or maybe UAE or India, anywhere, right? The moment you walk in, right, you see the nurse sitting at her desk. She's supposed to be taking care of patient, but she's running behind the admin. She's trying to get the patient's number, trying to get the patient's, I would say reports. She has to fill out those intake forms, verify those insurance coverage, nurse has to get assigned a hospital bed. Same thing happens at the small clinic. You go to any small clinics in the West Coast, East Coast, even in India, even in UAE, that they have one doctor and one executive assistant. The doctor, instead of treating patients, doctor is busy in paperwork, right? Figuring out patients' last 6 months record, last 1 year record, trying to do the billing, invoicing, right? Now imagine the time they should be spending in treating patients, spending on fixing the paper, the paperwork, right? Now that because of that, normally the same thing could be done within 15 minutes. The patient has to wait for 1 hour, 2 hours. Likewise, it happens to every patient. That kind of imagine it's a simple situation. Imagine you are at a kind of critical emergency, and whereas the patient needs immediate attention, whereas you are just filling out the form, you are just kind of trying to do this paperwork. How many lives are lost because of this thing? And to a data and survey, it kind of costs a lot of $1 billion of revenue losses to hospitals because they waste a lot of time, a lot of thing on paper. RxGPT does simple, right? Let's say, there's a nurse, there's a patient coming in. It's like ChatGPT, RxGPT. Just go to our tool, ChatGPT, like RxGPT, and type in patient X has come in. Please send me his last year, last 1 year, kind of records, right? You just want write one prompt like you're writing on ChatGPT. It sends you everything within 1 second, and then you say that okay, patient Y has come in, can you just do his, I would say, registration, do his thing in no kind of thing. So it's like an agentic AI platform that does everything with one command, like Claude Cowork does. Wise, no, it does everything likewise. Similarly, like a doctor is seeing a patient, right? No, sometimes he has to go through this papers, everything to turn the pages. I do have 6 months report, 1 year report. Now imagine now in RxGPT, he just goes in and type in that Mr. X has come to visit me. Can you just send me analysis of his last 1 year, 2 year reports? And you have all the reports stored in it. I know, I would say, maybe a drive, maybe cloud data. Now it can fetch all the data from there, analyze, say that okay, patient has this BP, blood pressure was very high last year. It came normal, see an abnormality. RxGPT does not consult or advise doctors on medication, but it helps doctors to find out the what's happening with the patient. And
Mm,
doctors normally know they have to go through the paper, then talk to their colleagues, figure out what's happening. It takes hours and hours. Now imagine within 2 minutes. 2 minutes you get the output. So how much time the doctor's time is saved? So then like instead of seeing just one patient in 1 hour, he can see 30 patients in 1 hour, right? Now it can also, in terms of revenue, it can help all the small clinics, healthcare to even increase their revenue. Also, saving lives, because imagine critical patient who is waiting outside, and he can be checked within 30 minutes, within 15 minutes, right? So that's the kind of thing it does, right? So likewise, RxGPT we have built around 7 agents. We're not going to go very thin, very vertically thing. First is lab report. Anyone, doctors and patients, they can check their lab reports immediately. Then radiology, all these things. And third, booking, and that we have in voice agent. All the clinics, all the healthcare are not call center. You don't have to have a no specially outsourced call center to take a call and talk to a customer. You should be only focusing on saving lives. Now we have a voice as in, like you and I are talking, right? So it can talk to customers, talk to patients, give them real-time answers. It's not like a pre-fed AI bot. It's a RAG-based, AI voice agent, like which can understand your past history, and current situation and advise and kind of tell you what to do, right? And talk to you. Let's say you're calling to the clinic, our voice agent picks up the phone, tells that, okay, Mr. X is there. Okay, he's not there. He will be coming tomorrow. Can I know a thing? Can I know a thing? Then it can also book that slot and send you an invoice within 5 minutes, right? And the time it will. So what are we doing is that we're saving time for patients, doctors, and hospitals, and saving time means saving lives, right? Now imagine you catch an accident and suddenly you want to figure out, is that do I get a O positive, B positive in the blood bank? Now you are making some random calls and everything to figure out. And when it comes to emergency, time means health, right? It's not about having everyone has money, right? But no one has time, right? It's kind of rushing against the time. Imagine that time when you call to hospital to our voices, and it's integrated to all the hospital network, all the kind of clinics across US, across thing. It can simply tell you, okay, yes, you should go to this hospital in the Maryland, not to here, because over there we have availability of doctor so, and we have your B positive or maybe O positive blood is there. You can just go there, right? So that kind of thing it can do. So that's the beauty of RxGPT.
Amazing. I think I really love the explanation that it's all about efficiency, but it's also about not only saving lives, but making room so that doctors are able to have more time to do their job or take in more patients as well. And something I do hear a lot is that the doctors have such limited time. And as a result of that, they're not able to give the full
Mm,
attention and care. Is when I hear this a lot also from my personal experience and also from friends and people and so on. So I think this platform and tool, it is, like you mentioned, it is really life changing. It is going to save lives as well. So I'd be curious to know as like a follow up question. So this platform, is this like integrated in specific clinics and hospitals? Or if so, I would love to know in terms of numbers,
yeah,
which
yeah,
hospitals, how many clinics, or maybe health
yeah.
insurance companies? How does it look like
Yeah,
so
yeah.
far?
Sure, sure, sure. So right now, to be honest, we spend around 9 to 8 months to do research, because healthcare is a regulated industry. It's not like any other open industry like hiring. Now you can just do something to build a tool and try. Healthcare, even if you're building anything, either SaaS or AI, you have to follow those regulations, all the compliances, be it in US, within India, within UK, a lot of compliances there, right? So it took us 8 to 8 months to just navigate through those compliances or regulation, do the research, because you are not allowed to. So let's say you build an AI, your AI cannot, treat patient. Cannot say that if you are depressed, take this medicine. It cannot do that, right? In the healthcare, you are not supposed to do all this kind of hallucination. It has to be the precise thing you have to do, right? It took us 7 months to do that. And then we built the first MVP in December, I think around January 2025. We launched a second version in March 2025, almost like 4 months ago. Now, in the month of April, we started a GTM, go to market, right? So, which we have around 13 plus incoming contracts from big hospital network from India, from UK. US takes time because of the HIPAA compliances. We all know that. So I
Yeah.
really kind of respect the regulation, but it takes time to get the foot on the door, right? And we have around 17 plus clinics where they are trying a pilot. Right now, they are paying
Okay.
customers, but they're trying, they're kind of trying a pilot. It's on almost because the moment it's not about, getting a solution and kind of launching it. It's kind of getting the customer feedback and improving the solution and then launching big, right? So right now we have like almost I would say pilot is going on. We have like 30, like 17 to 18 clinics who are who are paying for us and who are kind of trying our solution, and then we have around 13 to 14 contracts. But this incoming hospital network, they have like 200 plus hospitals in one network, right? So it's which means we're talking about around like 600 plus, no, around like yeah, around like 6,000 plus hospitals, right? Now to cater to those many hospitals, we need to upgrade our infrastructure, and that is why I'm also raising my Series A round because I don't think the kind of infra that we have, we can only cater to clinics, maybe 100 plus hospitals. We cannot cater to 6,000 plus hospitals. We cannot do that right now. That is why I'm raising a Series A round to get to
Yeah.
make us
Of
get
course.
to there. So that's the status of RxGPT, right?
Yeah. And you mentioned that currently there's some pilots running in, you mentioned like 17 hospitals or something like that. Where are
Yeah,
they
yeah,
all
yeah.
based? Which locations?
Yeah, the location mostly are, I just said, like Silicon Valley, West Coast,
Okay.
and around California, and there are around 4 to 5 hospitals also in UK, and one or two are. You will be surprised in Nigeria. So people
Okay.
are actually open to that, right? Now, why Nigeria is that because the barrier to entry is less, and people need healthcare assistance there. No, if you go to US, even go to Canada, the healthcare is pretty much very much good, right? Whereas no one is talking about Africa. We thought maybe I mean, of course, we always think about our profits and all, but at least for the sake of humanity, can we do something for Africa? That's where people need it, right? I understand they are not able to pay that much that US customers are able to pay. I'm willing to take a loss, but I'm just doing it to save lives there. It's not a my investors and all. They can the previous ones when they read the similar, they kind of question my vision that why are you launching in Africa? Is not a money making region, to be honest, because they won't be able to pay the kind of customers in the US and UK will pay. But I said, told them I'm not doing it for making money. I'm just doing it to help people, right? So because a business has to have a sustainability angle, right? It cannot be simply operating on a profit basis. It might be a loss making decision for me when it comes to Nigeria and Africa, but I'm proud of that because I'm
Of
through
course.
AI, I'm saving some lives there, right? So maybe in the future, when you have a larger round, maybe Series A round, we'll be able to spread out in Africa. But of course, there is a need to solve healthcare problems in Africa. Let's do it. Let's not just think about launching it in those profitable regions in US and making some money. That's not the purpose of RxGPT. The purpose is always to help people and save lives, right? That's the best way. That's the best region, Africa. That is why we launched in Africa.
Mhm. Yeah, at the end of the day, it's also about the impact that you leave. And I can see that all of this really started because of the personal tragedy that you've been through. And then
Right.
also that's why you wanted to continue to pass on and leave that positive impact as well. So I have a follow-up question when it comes to like the different locations. So I myself, I'm half German. So, Germany is of course
Mm,
really well known for the healthcare insurance, but at the same
yeah,
time, they are a little bit slow when it comes to the digital infrastructure in terms of
yeah,
it takes
yeah,
a long time to get
yes,
appointments. It's very slow.
yes.
So I'd be curious to know, do you have any plan that rolling out in Germany?
Absolutely. Right now, we're kind of going very focused way. I mean, at least have this 2 or 3 pockets where you go vertically and we kind of, at least capture the market. Then maybe in the next phase, obviously, we will go to Germany. That's not a big deal. But right now, just being very focused to solve these problems at a very focused level. And then once these problems are solved, once we get some results, no, right, then definitely we'll go to Germany and all these areas where there's a need for this, for this application.
Okay. And just out of curiosity, let's say there's a patient, they lived in one country and then they use this platform for all the information about their medical history. And then they move to a completely different part of the world. What are your thoughts in terms of, because, there's also the aspect of switching healthcare insurance
Mm,
and they need
right,
access to
right,
healthcare
right.
history. Do you think this would be kind of like the
Yeah,
tool to be able to
right.
escalate that? can imagine some people, they might have a very complicated history of chronic illnesses. So I'd love,
Got you.
yeah,
So in terms of patients' data, we have everything centralized in a in a centralized database, cloud storage. Accessing the data won't be a problem because it's the same data that is stored in the cloud, like the way you are using ChatGPT. Let's say you log into the ChatGPT now and you travel to Bali or travel to Maldives and you're logging from there, but same chat history will pop up, right? So likewise, comes to patient data is fine, but yeah, when it comes to the reset insurance provider, the providers, that will be, kind of changed. So for that thing, we should have that is why, we need a wider access. Right now, we have like 13 to 17 clinics and just 13 hospital network, right? So the more hospital network we have, insurance provider we have, then we can switch easily. Or else we'll have to talk to that, no, let's say new insurance provider, a new hospital healthcare in that location, in that geography, and try to set up a contract with them. That's the only way. Or else he has to just when it comes to insurance providers or hospitals, he has to be working with our current partners, not with the new ones. That's the only way. But we are thinking through. That's a good point. I must say we are thinking through. Is there a way we can make it universal like ChatGPT? But it's a B2B, right? It's not a B2C platform. B2C means you can easily make it. B2B means it has to have some kind of collaboration, the partnership deals to make you switch from hospital A to hospital B. Right now, it only works with the current set of vendor. Let's say hospital A is our vendor, so it works with wherever they have a hospital in world. It works with them. But when it comes to new hospital, yeah, we'll have to either be partnering with them or doing something else. But yeah, that's a good point. I would say
of
that's a very
course.
valid point you raised.
Okay. Tell us a little bit about your behind the scenes. How does your team setup look like at RxGPT?
Yeah. So RxGPT is a big team. It used to be a big team, but right now it's kind of become lean. We have a team of around 23 people right now at RxGPT. Initially, for 9 to 12 months, we only focused on building the AI thing, right? So we have a CTO under which we have all this agentic. To make an agentic AI platform, you need a front end team, you need a back end team, you need a cloud like AWS, GCP. You need also something called RAG, who understands RAG vector behavior. Without RAG is nothing, right? Then you also need someone who does very good UI UX design, right? And then you need a testing, I mean, who could test this application before launching it. So that's the core tech team, right? And as a startup, I don't think we need many people. I mean, we need, of course, we'll need later on. But right now, since everything is lean, we have like very focused roles, very focused kind of things. Two or three people working on one problem, like one senior, one junior. That's the kind of thing we have. And when it comes to marketing, if you do everything in marketing, you're doing nothing for startup. We have to be very focused on one strategy and one no one area at a time. So we have a GTM lead and we have an intern, GTM intern, and then and then we have like finance. Finance is also required, but he is a kind of consultant. He's not a full timer because right now it's all about building, scaling up. So we don't need a CFO. So we have a finance team, and there is also HR for because hiring is very essential for us. So say AI will reduce hiring. No, I don't believe in that. Still need people. We still need people. I don't think Claude can build this tool within one day. Claude can write some code, but still to understand people understand the requirements. We need people. We need people in the room. We need people to build, right. So hiring is very essential for us. We have an HR to do that. And I as a CEO, I kind of get into all this pocket on the highest level, right. So that's all that we have right now.
Yeah, just wanted to acknowledge that point, right? There's been a lot of fear when it comes to AI replacing jobs, but I think at the end of the day, it's come to show that AI is sort of like a
Absolutely.
supplement, but at the same time, we still need that human element as well, right?
Right, right,
Um,
right, right.
yeah, for sure. Yeah.
Because AI
Um,
cannot replace human consciousness,
yes.
intelligence, right? AI is just a
Mm,
tool. Like used to, you need a phone to call to your friends. Previously, used to have those landline numbers. Now have iPhone, right? So AI is like an iPhone. iPhone has no need when there is no person, right? Likewise, AI has no need when there is no people. And if you see a lot of the companies who have fired people to replace them with AI, now they are rehiring. We need people, but we need people who are skilled on AI. Okay, that is why I advise everyone. get skilled on AI. We need people who are skilled on AI. Yeah,
Mm.
AI will replace jobs, but it will replace people who do not have skills in AI. That's what I could say.
Yeah. Just the other day, I was having a conversation with another guest, and they were also talking about that AI essentially is kind of the new Microsoft tool, Microsoft Excel. It's like it's an essential tool that
Mm.
everybody needs to acquire as well. So you mentioned that for you, in terms of growing and building your team, what's really important to you is that they have experience working with AI. So from what you're seeing right now in the team setup, you have a really structured setup, in the in the tech world and marketing and so on. What do you think is the most difficult or role that you have to hire, or what is like the biggest operational challenge that you're facing right now?
Yeah, the biggest operational challenge we are facing is, I'll be very honest with you, the market doesn't have the right AI talents, right? People who just use ChatGPT to write some prompts, they call them some AI engineer. They are not AI engineers, right? We don't have a full scale or full stack AI engineer in the market who understands how AI works, what are the AI governance models, what are the AI ethics things, how do we orchestrate the AI agents, how do we build an AI workflow. People use N89. N89 is a it's like a Canva of MCPs, right? You don't need, I mean, that's not AI, right? You should, we need the actual AI engineers who understands, how to build this entire solution, right? And let's say, for example, I'm trying to automate HR or maybe automate hospitals, right? So unless I know the operational aspects of hospitals, how can I automate it? Let's say you tell me that, can you make something that would, record the podcast and just edit it, delete it, right? Now, if I do not know the process of how the podcast is recorded, how it's edited, I won't be able to automate that, right? So that's the domain knowledge lacking, right? So that is why, so that's the first thing. No? The right AI engineer with the right set of domain knowledge is not in the market. And the freshers who are there, they're good, but they don't have a domain knowledge. Someone as a fresher who just graduated with a AI, AI degree or maybe anything like that, they have not worked in the healthcare. They have not worked in the insurance sector. They have not worked in any of these, things. So how would they have that domain knowledge? And someone who has a domain knowledge, let's say 30 years, 20 years, he cannot even function in AI. He is is like too much. No, we try to do that. We try to upskill them, but they are like too orthodox to use AI. Learn LangChain, learn QAI, learn LandGraph, learn Python right now. So that's the thing. There is a lack of people who have both the domain knowledge and the AI expertise. You can find in software, you will find people who worked on maybe Angular JS or Java for the last 20 years, work in healthcare. So they have both domain knowledge and skill, right? In AI, that is not possible. You can't find many very very rare talents who have both domain knowledge of hospital healthcare and they also know how to build AI solutions because AI is new. That's a challenge I'll say. Second thing, sales. I'm
Okay.
not sure. I am not able to get sales people who understand how to sell, how to position a AI product in the market. Maybe it's new because of that. Maybe AI was always in the field of
Okay.
research, ML ops, right? Now because of agentic AI, it's being getting commercialized. So we don't find many sales engineers or sales guys who can launch this solution, approach customers, I would say present it, position it, and close it because they are all into either hardcore SaaS sales or hardcore B2B sales or hardcore all this kind of software sales. Software is different from AI. It's not, right? So that is where the finding even AI cannot replace you. You can build a SDR agent using agentic AI, but that cannot go to a hospital and close a deal, right? For sales, you need that human intervention. Even if I,
Absolutely.
introduce one AI agent, like we have built one AI agent SDR, but it can just send emails, follow up, but it cannot have that human connection to, I mean, that conviction, that, all the skills that a sales guy need to convert a customer, right? So sales and the first thing, second thing, these two are the primary, I would say, yeah, things that we are not able to solve, right? Having a,
Right.
a right AI talent with the domain expertise, and second, the sales guys who can do the sales for us.
Yeah, absolutely. No, I can definitely see that those are definitely like some of the operational challenges that you also want to solve next as well. And definitely, especially because as the world is evolving with AI. that's also like it also requires like this transition as well. And I can definitely see that it brings its challenges too. Okay, Silas, just one final question. If you could pass one advice to someone thinking of starting a business, what would it be?
I would pass so many advices. Anyone who wants to start a business, I'm sure the audience, young audience, don't like the word AI. Anyone who wants to start a young business, get into agentic AI. Agentic AI is the future. Find out any traditional business, maybe logistics, healthcare, or maybe supply chain, anywhere. Just go to something called, if you know about this site called Craigslist, is a very famous site in the US, right? Go to Craigslist, find out those traditional businesses, understand their workflow, their operation automatic. That's the agentic AI is going to feature. Because see, when you made when you made the internet, all those guys who build those big cables that they don't make money, but the guys who build this Google, Microsoft, right, all this on that internet web, they made the money. So anyone who build those models or maybe LLMs, all those data centers, they will make some money, but the ones who build those commercialize the products of agentic AI, they will be the ones who will be the next millionaires, the billionaires, right? So get into the field of agentic AI first, I would say, right? And second, I follow something called the theory of airport model, which means if you go to any airport, right, your flight never waits for you. You might not be ready, you might be not be ready, never wait. So never wait for the right time. Because AI is new, you might feeling that it's not complete, it's on pilot, it's not even complete. I should be waiting. Don't wait for the right time. Launch it, scale it, get
Mhm.
to the customer, get the feedback. It's okay to have a bad product. It's okay to have. That's how everyone starts. And then you kind of that, right? Those two things I can say to anyone who is starting to do something in the field of entrepreneurship.
Perfect. Thank you so much for the very concise and helpful advice. I'm sure that it's definitely going to inspire and also like shed some light for people considering starting a business as well. Well, Sal, it was very nice having you on the podcast. This is Carmen Durwald and Sal from Behind the Founders. Be sure to stay tuned for the next episode.
Thank you very much. Thank you. It was pleasure having being part of this podcast. Thank you very much. Take care.